The line chart that I'm about to share with you is quite spectacular. Now, we're looking at is the International Prostate Symptom Score in two different venues. Now, the one thing to look at in regard to the oral consumption, in this case, Salvia miltiorrhiza, otherwise often commonly known as Danshen, red sage, red ochre root, Chinese salvia, so on and so forth, but more commonly Danshen or red sage. Now, check this out. We're looking at improvements, amazing improvements in this outcome of the International Prostate Symptom Score in as little as 6 weeks, and then carrying out to 12 weeks overall. Now you have a couple different dosages. You have your placebo group, because this was a randomized, double-blinded, multi-center, placebo-controlled study. So you have your placebo, you have 400 milligrams of what's called Salvia miltiorrhiza extract, and as well as 800 milligrams, or root extract, I should say. But that is quite amazing. Look, 6 weeks. Now, I left this chart up here in regard to the International Prostate Symptom Score, so you can see what they were looking at in regard to the benefits of the outcome in regard to this particular study. Now, let's just look straight at the chart itself. And of course, you have your voiding and your storage. I'll let you figure that part out. But look at the speed in which progress was achieved just through the consumption of 400 milligrams, we'll use the lower dose in this case, of Salvia miltiorrhiza. Again, otherwise red sage or Danshen. But however, though, that is just astounding. So let's get right into the study as follows. Are you ready? Here we go. Salvia miltiorrhiza root extract for men with lower urinary tract symptoms, a multi-center, randomized, double-blind, placebo-controlled trial. The results, SAGX, you're going to see quite a bit, referring to Salvia miltiorrhiza root extract, which the intake groups showed statistically significant improvements in the total IPSS scores and several secondary outcomes compared with placebo group. Notable improvements were observed in symptoms of incomplete emptying, frequency, intermittency, weak stream, urgency, nocturia, and the quality of life scores. Understatement. Erectile function is assessed by the IIEF. Now, we're going to get into that study in the second half of this basic video, because the main thing we're looking at is a lower urinary tract symptoms improving. But however, though, yes, that improved as well. Also significantly improved, especially in the 400 milligrams of the SAGX intake group. No significant differences were found in PSA or testosterone. Now, that's going to go, wait a second. If there's no changes in PSA and testosterone, how are these symptoms improving? Now, they postulate potentially in regard to ROS, reactive oxygen species, and or they may be looking at inflammation as well. But again, future studies. No serious adverse events leading to discontinuation of study drug were observed in the SAGX groups. Conclusion, with fewer side effects than conventional treatments, the Salvia miltiorrhiza root extract group is effective and safe in improving symptoms of lower urinary tract symptoms and enhancing erectile function in men. Again, we'll get into that in a second. The backstory. The Salvia miltiorrhiza, commonly known as Danshen or red sage, a few other names on top of that, is a traditional Chinese medicinal herb and has been used for centuries to treat various ailments, especially in cardiovascular and cerebrovascular related disorders due to its antioxidant, stress, and antiplatelet aggregation effects. Recent studies have demonstrated the potential of this miltiorrhiza root extract in alleviating BPH symptoms. Again, without any statistical significance in PSA or testosterone. Interesting. In vitro experiments have shown that these extracts can inhibit the proliferation of prostate cancer cell lines, suggesting the compound's natural ability to modulate key signaling pathways, which presents a promising avenue for non-pharmacological intervention in these lower urinary tract symptom management. Further animal studies have revealed, remember the study we're looking at is a human study, but this is the backstory, revealed that Salvia miltiorrhiza extracts can reduce prostate size and improve other markers of prostate health in animal models of BPH. Again, the study we're looking at is a human study. Methods. A little bit of an insight into the preparation, if you want to look at that. As also, again, to reiterate, the test group received the Salvia miltiorrhiza root extract, was administered 2 soft capsules one day, totaling either 400 milligrams or 800 milligrams per day for 12 weeks, which is the length of the study. Although quite a bit of benefit was achieved after 6 weeks. Highlights. According to previous meta-analysis studies, alpha androgenetic blockers have improved the total international prostate symptom score by an average of 3.39 to 7.06 points. Whereas the study, after 12 weeks of the Salvia red sage group, showed an improvement of 4.4, 400 milligram, and the 800 milligram group showed an improvement of 5.03. Pretty comparable, confirming that this is not an inferior treatment. And of course, there were benefits even beyond that in the secondary outcomes. But to proceed, compare it to salpometo. Compare it to Serino Rupins, known for reducing as a salpometo, for reducing IPSS total scores by 3.0 to 3.2 in treating male lower urinary tract symptoms. Now, you would think, well, maybe since there's better quality of life through improving these symptoms in the urinary tract system, that maybe that salpometo would have the same, I would say, male erectile dysfunction benefits as well. Not so much. Wasn't shown in the salpometo, but was shown statistically significant in the Salvia miltiorrhiza red sage, which have demonstrated superior symptom improvements. So salpometo 3.0, 3.2, Salvia group 5.03 in improvement after 12 weeks. Additionally, the index of erectile function, International Index of Erectile Function, IIEF chart, total score significantly improved by the 12th week in the Salvia 400 milligram administration, suggesting increased efficacy with long-term use. Conversely, salpometo, as we covered before, did not produce significant changes in that score, highlighting Salvia miltiorrhiza potential advantages in enhancing sexual function, along with basically improving the lower urinary tract symptom scores. So there you have it. Let's look at these charts. All right, right there. There's your II International Index of Erectile Function charts. Just to give you an idea, what they're asking and what questions were covered in regard to outcome. Salvia showed statistical improvement, which is quite a positive outcome, even in combination with improving urinary tract symptoms. But to proceed now to the conclusion. The data from this study demonstrate that the Salvia miltiorrhiza root extract significantly improves symptoms in men with lower urinary tract symptoms, as evidenced in the International Prostate Symptom Score, and also showed positive trends in several domains of male sexual function, including sexual desire, overall satisfaction, as measured by, yes, there is one, International Index of Erectile Function. These findings highlight the potential of Salvia miltiorrhiza as an effective treatment, root extract, as an effective treatment for enhancing male sexual function, as well as improving lower urinary tract symptoms. Further research is needed, of course, as always, in larger groups, to fully understand the mechanism behind these improvements and to confirm the long-term efficacy and safety of Salvia miltiorrhiza root extract overall over time, even though Danshen has been used for quite a very long time as well. Still, just the same, you have to give gratitude to the researchers for looking into a different angle in regard to Danshen, Salvia miltiorrhiza, red sage, red ochre root, Chinese salvia, however you want to call it. The outcome is just astounding. Gratitude to the researchers. I am humbled you watch and can't wait to see what you and I discover next week. And look forward, of course, overall, that's the outcomes, to next week with you as well. All right, catch you all next time. See you then. Bye.